Do you drink caffeine in the form of coffee with no problem, but chocolate increases your heart palpitations significantly? Are you emotionally involved with chocolate? Do you just love chocolate? Let's learn what Dr. Eric Berg says on this heart palpitations.
Does chocolate have caffeine? Okay, and the answer is yes, it does something else called theobromine. Okay, now what is that? Well, this is also a stimulant. This is a stimulant, but theobromine is a vasodilator. Caffeine is a vasoconstrictor. What does that mean?
Why chocolate gives you that pleasure sensation? Cacao, the raw bean that becomes chocolate, is more than just a tasty treat. It's a hidden health treasure. Once fermented and processed, cacao and dark chocolate offer some amazing health benefits. Here's a fun fact. People eat around 6 billion pounds of chocolate every year. But it's not just for the taste. Cacao is packed with powerful nutrients like phytonutrients, polyphenols, and flavonols. These nutrients are even more abundant in chocolate than in superfoods like blueberries and acai berries. So when you enjoy a piece of chocolate, you're not just satisfying your mind, you're also giving your body a serious health boost. Chocolate is made up of more than 380 chemicals, but there are 3 key ones that really pack a punch. Let's dive into the first, phenylalanine. So what is phenylalanine? It's a crucial building block for dopamine, the feel-good neurotransmitter in your brain. Dopamine acts like a mood booster, traveling through your nervous system and elevating your spirits. It's the same chemical that gets activated when people use certain medicines to feel good. But that's not all. Phenylalanine also ramps up endorphins, those natural chemicals that make you feel Superman and uplifted. On top of that, it increases noradrenaline, a chemical that helps you stay awake, alert, and focused. Theobromine. Theobromine is often compared to caffeine, but it's a bit different. Yes, chocolate does contain caffeine, but only in small amounts, about 4 to 20 milligrams per ounce, much less than what you'd find in coffee or tea. Although theobromine is a stimulant that sharpens mental clarity and focus. Unlike caffeine, theobromine is also a vasodilator, meaning it helps relax and open up your blood vessels and reduces blood pressure. Caffeine, on the other hand, is a vasoconstrictor, tightening blood vessels and raising blood pressure. But here's the catch. If you have liver issues, like fatty liver or cirrhosis, your body can't process theobromine or caffeine efficiently. This can lead to problems like heart palpitations. When you combine theobromine, which can speed up your heart, with caffeine, which tightens your blood vessels, it can create those irregular heartbeats, especially if you're sensitive to stimulants. Some people complain to their doctor that their heart races after drinking coffee, while others say they experience heart palpitations after eating chocolate. Remember, everyone's body chemistry is different. For some, neither of these causes any issues. Even though theobromine helps relax blood vessels, it still stimulates the heart, which can trigger palpitations. And eating chocolate, especially late in the day, can keep you up longer than you might expect. Chocolate also contains tryptophan, an amino acid that helps produce serotonin, the neurotransmitter responsible for feelings of calm and well-being. Serotonin helps reduce stress and can lift your mood if you're feeling anxious or down, which is why many people turn to chocolate when they need a mood boost. But beyond all this, chocolate is loaded with other beneficial nutrients. Cacao and dark chocolate are packed with impressive health benefits, especially for the heart. One of their standout features is their ability to help lower blood pressure. This happens by boosting nitric oxide production, which relaxes the arteries and improves blood flow. Plus, the magnesium in cacao plays a crucial role in supporting this heart-friendly effect. But that's not all. Cacao can also improve your cholesterol levels by raising HDL, the good cholesterol, while lowering harmful oxidized LDL. Studies even show that cacao may reduce the risk of heart disease by preventing endothelial dysfunction, a condition that damages artery linings and leads to dangerous plaque buildup. Cacao is known to lower stress by reducing levels of cortisol and adrenaline, making it a great go-to during stressful moments. There's also some evidence that cacao could help prevent certain cancers, improve insulin sensitivity, and reduce the risk of strokes. Cacao is also linked to the prevention of metabolic syndrome, a condition involving imbalances in blood sugar, cholesterol, and blood pressure. But a quick note of caution: cacao is high in oxalates, which can be an issue for people prone to kidney stones. So, moderation is key. As long as you don't go overboard, chocolate can be a healthy treat. Just make sure to avoid eating it too late in the day, as it could interfere with your sleep. And always choose sugar-free chocolate. The regular kind, with about 30 grams of sugar per bar, is far from healthy. Sugar-free does not mean options loaded with maltitol, which raises blood sugar. Instead, look for chocolate sweetened with erythritol, stevia, monk fruit, inulin, or xylitol. These are great alternatives of bad sugars. Personally, Dr. Eric Berg enjoys a bit of chocolate regularly, always sugar-free and organic. It's important to avoid chocolates that have been sprayed with chemicals like glyphosate. Always stick to a couple of brands that use better sweeteners like erythritol, monk fruit, or stevia, which are much healthier choices.